All right, we'll bring you that report subsequently, but let's get to our conversation. I have joining me on the news at 10 to discuss the planned strike, the Vice Chairman ad hoc committee negotiating with the resident doctors, Tanko Yusuf Sununu. Good to have you join us. He joins us from Abuja studio. Good to have you join us.
Good evening.
Good evening. So, Dr. Sununu, the body language and the statement we're getting from the resident doctors is that nothing has been resolved yet. Talk to us about the talking points at that meeting and what the outcome was.
Well, thank you very much for inviting me to this very important discussion. We received an emergency letter from the Nigerian Association of Resident Doctors addressing the Speaker and informing him the intention of Nigerian resident doctors to embark on nationwide strike following the expiration of the extension of the ultimatum they gave the federal government. And in the tradition of House of Representatives being so proactive, the Speaker just came back out of foreign engagement, but he has quickly summoned the meeting of the Association of Resident Doctors, the Ministry of Finance, and also himself to chair the meeting so that we can discuss and iron out the issues. And he, quite all right, frankly speaking, pleaded with Nigerian Association of Resident Doctors to give him, at least in the next 2 weeks, to see what we can do. One sad news about this, it has been an ongoing issue, and virtually most of the issues that were discussed are issues that were known to us and also known to the government and to virtually everybody. It's sometimes saddens one's mind that where we are, you really don't know what is really happening. If you look at the major grievances, there is medical residency training fund, which is also that is supposed to be paid to residents. It's an allowance that will prepare them for the Part 1 and Part 2 of the West African and National Postgraduate Medical College examinations, so as to allow them to qualify as consultants to add to determine to reduce the demand of the specialists in the country, which is also provided for in the budget. And unfortunately, the preparation towards the payment of that residency training fund commences late, and therefore it couldn't have they couldn't have processed it before the expiration of the immediate past administration. So Mr. Speaker is now requesting the Association of Resident Doctors to please bear with the situation, and he's going to fast track ensuring that things are done and so that they can be paid immediately. And the other talking point that we'll also discuss is the one-on-one replacement. This is also an issue that everybody is aware in the country, that we are being heated so much by the brain drain. Doctors and other healthcare professionals are living in the countries in mass. I recall one of the oversight we went to Nursing Council of Nigeria. In 1 month, we lost about 1,700 nurses, giving us a total of 17,000, over 17,000 nurses that we have lost overseas as a result of search for greener posture and other better condition of services.
Absolutely, Dr. Sununu, if I may come in here, because you state the problems, but one wonders what the government is doing to address this. Earlier, you said these are issues that have been lingering from administration to administration, and you wonder why they have not been resolved, almost as though you are exonerating the National Assembly, which is also an arm of government, from all of these issues. You were part of the committee set up by the President Buhari administration, the Health Reforms Committee. Talk to us about why we have not seen any major reform in the health sector with all of this decay and challenges, even though you were part of that committee.
Yes, I'm actually part of that committee, but unfortunately, the report of that committee wasn't ready until almost last week of the immediate past regime's lifespan. And it was presented, and I think as part of institutional memory, the presidency will hand over to the current regime so that it can be looked into. But nevertheless, we found that this is a serious issue, and in a proactive way, the Speaker just today, following the emergency meeting we had, he has constituted a committee, which and a strong ad hoc committee to be headed by the majority leader of the House of Representatives, so that we can look at things critically. And we are hoping the first meeting of that committee will come up on Thursday of this week, so that we can iron out issues. There are some issues that work are in progress, and we ensure that we fast-track those issues about the strike. Everybody knows that abating the strike, as far as this time is concerned, it becomes seriously something that must be done. Because if you look at now the average purchasing power of Nigerian, and also the issue of the rising costs and inflation has made it difficult to allow people to continue to procure their services outside the public. Because if you look at it now, the WHO has shown that more than 70% of Nigerians are procuring their healthcare services through healthcare delivery, through out-of-pocket purchase, and the purchasing power of average Nigeria has gone down. So that's why Mr. Speaker find it
those 70%,
that he must call that
Dr.
meeting today
Sununu,
to address the issues.
Those 70% of Nigerians have to depend on healthcare here in Nigeria. They do not have the resources, to seek medical attention out of this country, and so they are depending on you and this current administration to ensure that this strike doesn't hold. We can look forward to the outcome
stable
in the coming
service
days. But
delivery.
I'm afraid we do have to leave it there. Thank you so much for talking to us, Dr. Tanko Sununu.